the guidelines had recommended to start treatment when the blood pressure was more than 140, the top number, what we call systolic, and 90, the bottom number. But over the last 5-10 years, there were many large, good scientific clinical trials that compared people in two groups. In one group, they lowered the blood pressure to about 120 by 80 to 130 by 80. And the other group, they went to the target of 140 by 90. And almost all studies consistently showed that in the lower blood pressure group, there were less heart attacks, less strokes over the long term. So we got pretty good data over the last 5-6 years that lower is better for most patients. Eventually, it may happen that there'll be more people who will be treated with medicines for blood pressure. But the guidelines are not pushing drugs. In fact, the guidelines that just came out from the American Heart Association say that it's important to recognize that you have a blood pressure 130 by 80 or 135. It's not normal for you in the long run. So do everything you can to bring it down. We have great lifestyle modification tools that are not being pushed at all these days, which we should push. So there'll be a minority of patients who, if they do the lifestyle modification, will still need blood pressure. So I think overall, the health of the population in the long term will be better, and a small percentage may go on medicines that are not on. They should not be worried, but they should be more aware of what they can do to lower their risk. See, with blood pressure, lower is better. 120 is better than 130, 130 is better than 140, and so on and so forth. So for adults, as we get older, the arteries get stiffer, our food habits and exercise habits go down, so blood pressure goes up. So if I have a blood pressure of 130 by 80 today, consistently, versus 120 by 80, I have a less chance of having a stroke at 120 by 80 than 130 by 80. So I should be worried enough to eat less salt, eat more fruits and vegetables, and exercise more, and perhaps lose some weight. So the average American eats about 3 times the salt that we should eat by the guidelines. And salt is very, very key in making blood pressure go up. So the easiest thing is be aware of how much salt you're eating in your diet. Look at the labeling in the back of the food. And once you start doing that, you are more aware and you'll subconsciously cut down. So salt restriction is the most important thing for blood pressure control. And exercise, even if one doesn't lose weight, but one becomes more active, does 30-40 minutes of exercise, walking, bicycling 3 times a week, that also brings the blood pressure down by 3 or 4 points. Blood pressure is such a public importance topic, and the lay press and media has picked it up very quickly. There are radio talks about this, there are morning daily shows. So I think patients are going to ask doctors about this so often, and I think all societies are looking into this very actively. So I think it may take some time for the system to catch up in terms of helping patients' lifestyles, because we are geared towards medicines more than lifestyle changes. But it's going to happen very quickly. I think how we check a blood pressure is really important. Blood pressure is meant to fluctuate. When we are stressed, when we are anxious, when we had caffeine in our diet, blood pressure goes up. And blood pressure in the doctor's office is higher than at home. So the guidelines recommend that don't trust one reading. If your blood pressure is 138 or 140 in the doctor's office once, go home, buy a cuff. Cuff is cheap, it's $30. Or even stay in the doctor's office for 15 minutes in the waiting room, relax, and check it again. If consistently at home your readings are more than 130 by 80, then you will qualify as being called a stage 1 hypertension.
Hi, I'm Michelle. Carla. And I'm Ward. Are you having any pain today? No. Any falls, non-healing wounds recently? Nope. Good. Okay, she's going to do your blood pressure. Okay. And this form is okay for you, correct? Yes, ma'am. Okay, here we go. I'm also going to get your temperature right under your tongue. 99.9.
112.0. Okay, everything looks good. 112/62 is your blood pressure, which is normal. 99% for your oxygen. And then your heart rate is 79, which is also normal.
Okay.
Very good vitals.
Okay,
Thank you so much.
Thank you.